Welcome back, everyone. Next up, we have Cloud DX Inc. It trades on the OTCQB under the symbol CDXFF and on the TSXV under the symbol CDX. Its connected health remote patient monitoring platform is used by healthcare enterprises and care teams across North America to virtually manage chronic disease, enable aging in place, and deliver hospital quality post-surgical care in the home. Please welcome its CEO, Robert Kaul. Welcome, Robert. How are you doing today?
Very well, Anna. Thank you. Thanks for having me.
Good. We look forward to hearing the presentation. Take it away.
Wonderful. Thank you, everybody, for joining us today. And I'm really excited to share the news with you. Very quickly, just to bring this into context, Cloud DX and our connected health platform consists of three main components. We're going to talk about those, and then we're going to talk about how we're bringing those to the world today. We have what's called the Connected Health Kit, and that's a kit that your doctor prescribes for you that you would take home with you to use to monitor your vital signs and your activity at home. It also includes a tablet computer that allows you to have two-way telehealth or telemedicine conversations with your care team or your clinician, answer text messages, answer surveys, and really be involved in your own care at a very high level at home. The clinical portal is where doctors and nurses monitor patients using the connected health system. One doctor or nurse, or usually it's a nurse, can monitor hundreds of patients simultaneously because smart software in the background is managing and triaging those patients to make sure that only the patients that need attention are brought up at the beginning of each shift. And then the third big thing what you do at Cloud DX is integration services. And we're going to touch a lot on that today with the partnerships that we've created in the last few months. The Connected Health Kit is a very advanced kit of medical devices that are FDA cleared, Health Canada licensed, some of which are manufactured by Cloud DX itself, and others of which are leading devices in their category from other manufacturers. And the clinical portal achieves very high usability and satisfaction scores, is constantly being improved and upgraded with feedback from our clinical partners. Integration services are a large part of our and growing part of our business, and we'll touch on that too. As with all of these presentations, you're going to hear some forward-looking statements, so please take a moment at some point, if you're interested, to read the forward-looking statement disclaimer. Cloud DX is just over 8 years old now, and we really have three claims to fame, three major differentiators that make Cloud DX different and superior, in fact, to our competition in the remote patient monitoring business. We're going to talk a lot today about our partnerships, our large and growing commercial partnerships. We announced yesterday an additional and very exciting new level of partnership with Medtronic, who's the largest medical technology company in the world, a company traded on the New York Stock Exchange that has a market cap of well, it's very large, billions and billions of dollars. We're also partners with the largest telemedicine company in the world, Teladoc Health. Teladoc has a global footprint in 120 countries, over 5,000 employees. Teladoc Health touches 5 million patients every single year. There are more partnerships as well. These partnerships and the technologies we bring together are driving huge growth at Cloud DX. So far this year, we've signed 24 new contracts, which is double the pace of last year. It's a 200% increase. And this is only so far as today. The rest of the year is still to come. We're also recognized as innovators. Cloud DX has earned 17 awards for innovation, including awards that are extremely prestigious, like the Edison Award, and of course, our Bold Epic Innovator Award from the Qualcomm Tricorder X Prize. The important part about these awards is not just the accolades that come with them, as we'll touch on in a moment, but the research opportunities and in many cases, non-dilutive funding. The two biggest partnerships we're talking about today, of course, are our partnership with Teladoc and our partnership with Medtronic. And of course, these companies don't compete with each other. We become a bridge between Teladoc, the leader in telehealth and telemedicine, and Medtronic, the global leader in hospital-based surgical care and acute care, as well as a growing footprint in areas like kidney disease and neurological disorders. So those partnerships have been announced. We're also partners with Equitable Life Canada in a unique partnership. For the first time, a large insurance company has actually purchased virtual care services directly for their members. CBI Health, one of the largest home care agencies in Canada. Medio Logistics, which has a footprint across North America, delivering and fulfilling RPM projects and RPM kits. The Population Health Research Institute, which is one of our largest academic partners, but is also doing gigantic studies using Cloud DX with tens of thousands of patients, the Lung Health Association, Oregon Health University, and more. So moving forward to yesterday's announcement, Cloud DX is participating in co-leading the Continuous Connected Patient Care Project. This is a project led by Medtronic Global or Medtronic USA and includes a number of smaller companies from Canada to bring new technology together onto the Cloud DX platform. The project has a budget of over $12 million with $5.2 million in non-dilutive cash from the Digital Supercluster, which is a funding agency in Canada that helps large companies and small companies partner in order to bring new technologies directly to market. Cloud DX is receiving just under $600,000 to integrate new technologies into our backbone, validate it with our academic partners, and take this to market through Medtronic to 125 countries around the world. So 3 big important things about this new announcement. The first is, of course, it's with Medtronic Global, which is it's a fantastic connection. Our partnership with Medtronic Canada continues to grow. The second thing is that it generates nearly $600,000 in direct cash for Cloud DX. And the third thing is, of course, that global distribution as the project comes to completion in 2024. This is the cherry on the sundae for a fantastic year at Cloud DX. I mentioned already, we've signed 24 contracts at Cloud DX, double last year's performance so far, and the year's not over yet. We've seen 3 published or announced studies proving very high patient satisfaction, which in turn drives reimbursement for US clients. Satisfaction as high as 96%. We've published peer-reviewed papers. We have seen new patents granted, and we've had regulatory success with 2 major regulatory audits. These are regulatory audits, not financial audits, regulatory audits with no significant findings, which means our quality and our privacy and security are world-class at Cloud DX. So to bring this back together with what exactly Cloud DX delivers to the market today, we call it virtual care as a platform, and it includes the following bits and pieces. Connected Health is the kit that goes home with the patient. We've discussed that earlier. The clinical portal is the portal that patients are monitored through by the clinicians. And the services and integrations are the third source of revenue in our financial statements. You'll see that. Client training and onboarding, virtual patient enrollment, patient compliance support, which is a huge differentiator at Cloud DX. Custom features delivered very efficiently. And this is where we're integrating both Teladoc and its solo platform, which includes telehealth and clinic management software. And this is where the new Medtronic technologies will also be integrated together, creating an ecosystem that has never been seen before. It's going to do things that are critical and important. It's going to generate additional revenue through new reimbursement codes, and it's going to be ready for worldwide distribution as it comes together. Cloud DX technology is protected by 8 families of granted patents, including patents internationally now in Canada and the United States, and patent applications in the European Union, China, and Australia. Why is virtual care becoming such a big deal? The reason why is because it hits 3 major value propositions that all are absolutely necessary today to make healthcare work across the world. The first is to get patients home from the hospital as quickly as possible. This is the point of the CCPC program. It's designed to safely discharge patients from hospital to home care using technology, freeing up that hospital bed, getting patients out of hospital sooner. That drives efficiency for all parties. It's better for the patient, it's less risky, but it dramatically drives down the cost of each actual patient hospitalization event. This is going to reduce the backlogs that still clog the system due to cancellations from COVID-19 during the pandemic. It also helps patients avoid going back to the hospital or going back to the ER. This entire efficiency envelope generates tremendous ROI. It saves money for payers like the Canadian healthcare system. It drives additional revenue and additional profits for payers in the US healthcare system. That's the key. The available markets are enormous. Over 65 million Americans are Medicare beneficiaries that have more than one chronic illness. Those beneficiaries qualify for reimbursed remote patient monitoring, and that business is growing very quickly. The post-surgical business is also growing quickly, both due to the pandemic backlogs and the need and desire to increase efficiency because, quite frankly, there just aren't enough doctors, there aren't enough nurses. The burnout from the pandemic is deeply impacting the healthcare systems in all parts of the world. Doctors and nurses are quitting in droves. The system itself is getting more and more stress. This technology is one of the solutions to that problem. Because of this growth curve, this is an example of an estimate as to how many American adults will be using some kind of monitoring solution by 2025. 70 million adults. Obviously, Teladoc Health and Medtronic are deeply involved in that growth. And as their sole acute care partner, CloudDX will be participating as well. In the Canadian context, for those who are not familiar, CloudDX sells directly to provincial governments who are the main providers of healthcare in the Canadian system. But in some provinces, we also work directly with hospital systems. And in particular, in Ontario, we work with the community paramedic systems. That group, community paramedics in Ontario, received a large bucket of funding last year to deliver virtual care in order to reduce wait lists for long-term care. This funding came from the long-term care ministry rather than the health ministry. It's a new bucket of money, and CloudDX has announced 6 contracts in that space so far this year. We are indisputably growing in that space as one of the market leaders, delivering a very efficient form of care through the paramedic service, which is something we expect to see grow in other jurisdictions soon. In the US context, we sell to hospital systems, and we sell directly to clinics that work with Medicare and Medicare patients and patients under private insurance who need remote patient monitoring and is fully reimbursed by that insurance and by Medicare. That reimbursement pays us directly to deliver care for $58 a month per patient. So think about that in terms of every 1,000 patients, $58,000 a month. It's about $750 a year. As we grow, we start to see a very profitable business at only between 10 and 15,000 patients. That milestone is directly in sight now. Under the partnerships we currently have, Medtronic alone in Canada touches over 2 million patients. Teladoc, just for the high acute use cases we're talking about, touch over 3 million patients. So our growth now is not dependent on any breakthroughs in technology or breakthroughs in regulation. Our growth is simply dependent on executing with the partnerships we already have. Just coming back to the awards of excellence we've received, I want to note that CloudDX has received over $11 million in non-dilutive funding to commercialize our products, including just over $5 million through the X Prize Foundation and the Roddenberry Foundation. And those funds have been spent in order to bring our new technologies to market. And we'll touch on that in a minute. Last point, very quickly, before we start to wrap up, CloudDX is tightly held. Insiders at CloudDX own over 34% of the available shares issued outstanding. And we're all escrowed and agreed not to sell our shares, especially now. So the growth is absolutely growing quickly. Wrapping up our differentiators, CloudDX is arguably one of the most innovative companies in our space. We have the awards to prove it. We have the partnerships to prove it. We drive patient satisfaction, which again drives reimbursement. Those satisfaction numbers mean that the technology is being deployed and actually used to gain the benefit. And then again, our whole point today is to mention that our partnerships have now blossomed. Our Medtronic partnership now includes the whole world. And that growth continues, and those partnerships are still growing as we speak. CloudDX is meeting real needs. 1 in 3 patients, or 1 in 3 adults in North America has some chronic disease, starting with hypertension. 1 in 6 has a neurological disorder. 29% of surgeries have serious complications. We have the published studies to prove, peer-reviewed studies to prove that our technology is superior and that it impacts outcomes and drives savings at ROI. We have the user satisfaction that proves that our technology is superior. We have the largest deployed footprint in North America with regards to entire provinces, hospital systems, clinics, municipalities, and partnerships. And our growth continues to accelerate. So I'm going to pause there now. And I think at this point, we have time for some questions. And then if there's a little time left over, I might point out some of our new technologies. But okay, why don't we let's start for questions.
Great. We have a question from Gary Zwetchkenbaum. This Medtronic announcement is very promising. So what does CloudDX bring to Medtronic, and why do they choose you as their partner?
It's an excellent question, and it's kind of an interesting story. Clearly, a company like Medtronic could develop remote patient monitoring technology in-house, but Medtronic also has a mandate to grow quickly, and developing the technology at Cloud DX has taken several years and millions of dollars in investment. Getting it to market quickly would be extraordinarily difficult, even for the largest companies. But what Medtronic did in Canada was they actually spoke to our joint customers. They asked hospital systems that they work with across Canada, which remote monitoring companies are you working with and which ones do you like the best? And almost universally, the message came back, you should work with Cloud DX. And Medtronic then got in touch with us, put us through 7 months of due diligence, and we signed our first contract with them a little less than a year ago. And we've been working through that contract all year long. We've announced one hospital partnership so far, more in the pipeline. But of course, for many months as well, we've been working on this CCPC deal with Medtronic USA. And so this is the fruits of the partnership. We bring a mature technology platform, fully deployed, fully approved by regulators, with the metrics and the published papers to back that up. There's no way to short circuit that. And so Medtronic has chosen us because we deliver value for them. And of course, obviously, they deliver massive reach for us.
Fantastic. Another question from Gary. You've announced a number of partnerships in 2022. So which partnerships are expected to generate the most revenue in the next year or two?
So that's another great question. And you see, at Cloud DX, we have our own internal sales force. We're generating our own sales leads. We're not dependent on any one partner for the majority of our business. But I think there's really two ways this is going to grow. Our partnership with Teladoc Health has tremendous potential in the United States. Teladoc itself in the US is the absolute market leader in telehealth, but their client base is almost entirely corporations and enterprise. They currently do not sell to the hospital system, and they currently do not engage with insurance companies. We bring to them the ability to do that. That, I think, is going to give them a whole new area to grow into, using Cloud DX as our partnership together. It's a very tightly integrated partnership. So we expect that to grow rapidly starting in mid-2023 as that comes together. The Medtronic partnership, though, I think will start to deliver new contracts and revenue sooner because we've been working with them a little longer. And I think Medtronic is going to actually be a very strong partner for us in 2023. And then, of course, when this new technology we've just announced yesterday comes to market in 2024, then we're really going to see some acceleration. So it's a bit of a horse race between the two giant partnerships. And then the remaining partnerships we've discussed, like CBI Health, also have the ability to generate tremendous growth. So these are all happening around us while we're going to market ourselves through our marketing and sales activities in the United States. And so I think it's going to be maybe a third, and a third.
Fantastic. Follow-up question from Gary. It seems like remote monitoring and virtual care, they're growing fast, and Cloud DX is having a good year. So how do you account for the low market caps of companies like Cloud DX and others in the space?
This is a question we get from investors all the time. And I think we have to step back for a moment and look at the entire market. Cloud DX was actually on a growth trajectory, market cap wise, in this right around this time last year, before macro events intervened, starting with the changes in inflation and the changes in interest rates, the war in Ukraine, and all of the political tension leading up to the elections in the United States. All of this has distracted investors from growth stories. A lot of money is sitting on the sidelines right now. So we all know that this is cyclical. We all know that this won't last forever. And we all know that within a relatively short period of time, we hope, investors will come back to the market and start looking for those opportunities that are really, that have what it takes to grow quickly, that have the partnerships, that have the technology. And we're confident that Cloud DX is going to be counted among those. I think we're in good company in the sense that both the best companies we're all seeing reductions in our market cap, but I think the very best companies are going to rise the fastest as the rebound starts, hopefully in early next year.
Great answer. Alan Klee asks for Medtronic contract that it's expected to launch in 2024. So who is the end customers looking to sell to?
Medtronic around the world sells to hospital systems and healthcare providers. So this is not a direct-to-consumer product. This is a product that's purchased by hospitals and deployed in the healthcare system to improve efficiency. So the end product, the end client in the context of Canada is the provincial healthcare systems. And in some provinces, their powers are devolved to hospital systems themselves. In the United States, the client is the hospital systems, the big hospital systems from your Mayo clinics and your Cleveland clinics, all the big hospital systems in Houston. These are all very large Medtronic customers. Around the world, in some countries, like in the UK, for example, these technologies are purchased directly by the National Health Service. In other countries like Germany and other parts of Europe, they're purchased by state agencies. So it's a complicated world, it's a complicated place to try and do business. And the real benefit to CloudDX of this partnership is we have the best possible partner with the largest possible footprint to maximize this distribution for us in the coming years.
Fantastic. So continue on with that partnership. So what does it do over the next 12 to 24 months as far as sales and going cash flow positive? Emily Russell wants to know.
As I mentioned earlier, CloudDX starts to see profitability when we hit between 10 and 15,000 patients on our system. We currently have just over 3,000, and that's up from under 1,000 previously in last year. So the growth trajectory continues. And that's not including other sources of income that we have in our financial statements, like services income. So it's a complicated mix a little bit at CloudDX, but the cash that's in this initial contract, the $560,000, of course, is very welcome as far as funding and cash is concerned. I think that the additional work we're doing with Medtronic Canada outside of this contract is also, that funnel is also filling up rapidly. And so CloudDX makes a profit when we sell those connected health kits, that equipment, and in some cases we sell those up front. And then we make an additional revenue stream per patient per month on those subscriptions as each patient comes on our system. If the equipment is paid for up front, that cost is about $30 to $40 a month. If the equipment is amortized, which it is in many cases in the United States, that cost goes up to $60 a month. So you see, if you do the numbers, that as we cross the sort of 10 to 15,000 patient mark, we're moving into the $10 to $15 million a year range. If we could get to 25 to 30,000 patients, which is just a matter of work at this point, now we're moving into a very profitable company. So I think that the relationships and partnerships we have are very much turbocharging that growth because it leads to that additional distribution and, frankly, a lot more very talented people out there selling CloudDX.
So Ben P. and Alan Klee want to know, how many verticals of revenue do you have, and how does this revenue model work in terms of getting paid, and discuss some onboarding or any other issues associated with that.
So again, going back to the verticals, there's three big buckets. There's product revenue, which is the connected health kits themselves. There's services revenue, which is that per patient per month stream of revenue as each patient comes on the system. And then there's services and integration revenue. There's a fourth line item on our financial statements you also have to pay attention to, and that is in the IFRS statements we issue, something called government funding. Particularly in Canada, because healthcare is paid for by the government, some contracts we sign and some funding we receive is counted by our auditors as government funding, whereas in the United States, that will be counted as revenue. So you do have to add them all up. And as we see, you see the product revenue can be a little lumpy, because these large orders for connected health kits come through in some quarters, but not in every quarter. Subscription revenue grows steadily. As more and more patients come on our platform, more and more of that subscription revenue grows. And that percentage growth rate quarter to quarter is a good indicator of how quickly we're going to reach cash flow positive. And then the services revenue is also a little bit lumpy, but more steady, because each contract that comes on generally requires some customization in order to make it work. On the point of onboarding and compliance and maintenance of the patient base, we are superstars. That patient compliance piece is something CloudDX does as a service for our customers, built into our pricing. We're unique in that way. No other client or no other vendor that we know of does it quite the way we do. But what that does is it first relieves the client, it relieves that provider from having to do compliance and customer service calls. It also puts us directly in touch with exactly how our system's working. We can improve it on literally a daily basis. And that's driving our improvements and making those satisfaction scores go even higher. So that, plus partnerships with organizations like Medio, who do kit fulfillment, put us in a very strong position to win giant contracts based on our track record in that compliance and patient onboarding world.
Fantastic. Luke Gardner wants you to talk about how this technology could affect medical costs and insurance premiums.
The highest costs in all of healthcare are really two conditions: congestive heart failure chronic obstructive pulmonary disease. In North America, over 75% of healthcare costs go to people with those conditions, exceeding cancer, exceeding surgery, exceeding accidents, you name it. These are older folks. They have multiple comorbid conditions, and we all know, we've heard the stat, 80% of healthcare costs are consumed by under 20% of the population, and they're generally people over the age of 75. Remote monitoring has been proven time and again in peer-reviewed published studies to reduce the hospitalization rate of those patients. Every time a COPD patient goes to hospital, it costs the system, whether that's an insurance company, Medicare, or a Canadian province, $7,500 on average. If that patient winds up in the ICU, which many do, it's $30,000 for that hospitalization. So by attacking this lowest hanging fruit with the technology we're deploying through our partnerships, we are in a position to drive down healthcare costs or help maintain a lower increase in healthcare costs by literally hundreds of billions of dollars once fully deployed across North America, and multiply that around the world. It's probably the best and fastest way for the healthcare system to improve efficiency. Monitor patients in a setting that's much lower cost, and it's much better for the patient, which is the comfort of their own home. And that's why the whole concept is growing so quickly.
Great, great answer as well. Sabrina Martinez wants to know about breaking into the U.S. markets. Do you have a time frame for that?
Well, we are already in the U.S. market, and we're growing quickly. We have hospital partners in Illinois with Blessing Hospital and in Oregon, and we have a growing number of contracts across the U.S. Of the 24 contracts we've signed so far in 2022, 11 of them have been U.S. contracts. We have sort of two different ways we do that. We have our own sales and marketing team that's made up of some really passionate people who are signing up clinics that specifically work with those patients who have those diseases I just mentioned. Most of those clinics have between 1,000 and 2,000 patients that they care for. And of those, somewhere between 500 and 1,500 qualify for and are appropriate for remote patient monitoring. That tends to drive hundreds of thousands of dollars in new revenue for the clinic, improves patient satisfaction, and again, drives down those costs. We've identified through our marketing techniques over 10,000 prospects in our sales pipeline, and we're onboarding them as fast as we can. The sales cycle for a clinic like that is several months. And so we've really broken out in 2022. We're going to see those sales accelerate in 2023. And that's completely parallel to the work we're doing with Teladoc Health in the US, and now, of course, with Medtronic USA as well. So we are, in fact, earning substantial revenue already in the United States, but the growth trajectory is quite substantial.
Anthony Fitzgerald wants to know who the largest competitors are in US and Canada for you. And does CloudDX require FDA approval?
So two completely separate questions. The FDA approval, the answer is yes, but we have all of those approvals in place. CloudDX is an ISO certified developer of software and manufacturer of medical technologies. We're FDA registered. All the technologies we deploy are FDA cleared and Health Canada licensed. That is, in fact, a strong moat to other startups trying to get into the business. It takes a long time, a lot of work, and a lot of effort to achieve those, a lot of cost. But having those in place puts us in a strong position to grow. We have competitors in sort of different directions. In the Canadian context, there are domestic like TELUS Health, which is a division of a large phone company. So really, remote patient monitoring is not their core business. And then there are smaller competitors, companies like Atonix, that don't do exactly what we do. So we tend to, in fact, win out in many cases because of that. There is another competitor that's leaving Canada, a US company that has been there for several years, but is now pulling out because their parent, they were acquired, their parent, Optum Healthcare, only does business in the United States. So they're not doing business in other parts of the world. In the United States, there are more competitors. There are a number of competitors that do remote patient monitoring. But coming back to our core differentiators, these competitors are not as innovative as we are. They don't manufacture, in almost every case, they don't manufacture their own medical devices. So we have a cost advantage. They don't do the compliance and patient management that we do. We call that patient first. They don't do patient first. That's a strong differentiator for CloudDX. And of course, they're not partners with Teladoc Health, and they're not partners with Medtronic. So we're in a strong competitive position. Now we're going to complete our fundraising, and we do have a fundraising completing this month. And I think then we're on a sprint to get to that cash flow positive.
Great. Alan Klee with Maxim Group wants to know if you can comment on reimbursement rates for remote care and chronic care.
CMS, the Centers for Medicare and Medicaid Services, set the bar for reimbursement rates for RPM, which is remote physiological monitoring, and RTM, which is remote therapeutic monitoring. They reset those rates every year through something called the physician fee schedule. And then private insurance companies usually then adopt the same rates about a year later. CMS has been tweaking the reimbursement rates at different points to try and make them as efficient as possible to gain the best bang for the buck for taxpayers. But at the same time, they've been adding new ways to get reimbursed. So what we've seen at Cloud DX is we've seen slight reductions in certain CPT codes, they're called billing codes, for certain RPM features, but we've seen the addition of new RTM codes and additional codes on top of that for chronic care management, such that, in fact, a clinical practice can still increase the amount of revenue they receive per patient per month with some clever and fully accepted maximization of the available codes. So CMS and the insurance companies in the US continue to invest in reimbursement for RPM. And in fact, the reality is that a lot of the changes that were put in place during the pandemic through the public health emergency have now been made permanent. So it seems very clear to us that the value stream and the reimbursement streams are actually going to be maximized rather than minimized, because as long as there's value there and as long as that ROI is there, this is a tremendously powerful investment for those payers to improve efficiency and improve the bottom line.
Fascinating time. We have one last question from Gary Zwetchkenbaum. What percentage of business or sales is in the U.S. now and will be projected by the end of 2023? Can you talk about that?
Excuse me.
I know. It's contagious.
Yeah, it's a little challenging to answer that question, only because, for example, our relationship with Teladoc Health was just announced in August. And so that the growth rate in that vertical with that partner is still sort of really coming into focus. But I think we can say that right now we generate about 70% of our revenue in Canada and about 30% in the United States. And I think within that, maybe 1 year to 5 quarter timeframe, those numbers will flip, and we'll see 70% US, 30% Canada, and then from there we'll see global revenue increase as well because of our partnerships with these giant companies. So, you know, Canada represents a great homeland for us. We are the market leader in Canada. We are driving change, and we are making a huge difference. All the big Canadian provinces today have either issued or are about to issue an RFP, a request for quote, for a single vendor for the whole province for remote patient monitoring services. So the Canadian system is very much investing in remote monitoring right now. Millions and millions of dollars are being funneled to that. We can't guarantee we're going to win all these RFPs, of course, but the important point is not that. The important point is the market for what we do at Cloud DX has increased exponentially between 2021 and 2023, and that growth is benefiting our shareholders dramatically.
Fascinating, exciting times. What a great industry to be in right now. So, Robert, thank you so much for joining us again, and come back with some more updates, please.
I will. Thank you, everybody, for your time. If you do have any other questions that weren't answered, please get a hold of one of our IR reps or go on clouddx.com and the investors page and send in your questions. We'll appreciate it.
Fantastic. Thanks, Robert. See you again soon.
Bye-bye.
Okay, everyone, stay with us. We're moving on to our next presenter. We'll be right back.